Hi, my name is Stan. I've talked to Dr. Blick, my doctor, about making a video for men that would help give you an idea of my travels and my challenges as I tried to solve my erectile dysfunction problem. About a year ago, my wife and I went to Hawaii for our anniversary, our 20th anniversary, and my wife had planned a very special evening for the two of us. Unfortunately, because of my erectile dysfunction, I was not able to participate in intimacy. And I was very disappointed, and she was very disappointed as well. So when I came back from Hawaii, I decided to look for a solution to my erectile dysfunction more aggressively. I did some research online on the internet and found the information to be sorely lacking. And what I mean by that is there was a lot of misleading information, there were old wives' tales, and there was some stuff that was just plain wrong that I found on the internet and was not very helpful. So I started on a year-long challenge to solve my erectile dysfunction problem. I tried all the oral medications. I'd gone to my primary care physician, and between the two of us, we had tried all the oral medications that were available. And some worked, some didn't, and some worked intermittently. So that wasn't a very good solution for us. The next option is we tried a vacuum pump, a mechanical device that helps you achieve an erection. And that was a very cumbersome, difficult device to use, and it took out the spontaneity in our relationship and our intimacy. Then I looked for a urologist, and we tried penile injections, and they didn't work for me as well. So I decided to talk to other doctors about a penile implant. So I talked to 6 or 8 doctors in the area, and I went to 3 of those doctors to talk to them about a penile implant. And I came across Dr. Blick. And one of the things I was impressed with Dr. Blick about was he did not rush me through the appointment. We sat down and discussed my concerns and what I had done in my treatment of erectile dysfunction and what I felt my last option was, which was the penile implant. And he agreed that this was probably a good option for me. Now, before surgery, Dr. Blick had an appointment with me to go over the surgical procedure and what to expect and what the outcome is going to be. But he also had an appointment with my wife and I together because she had certain questions that were important to her, such as what was involved in the surgery and how the device was going to perform after the surgery. And she walked away from that meeting with a much better understanding of the process and what the expected outcome was going to be after surgery. On the day of surgery, it was an outpatient procedure, so I went in, met the doctors, the nurses, and all the staff that was going to be on the operating team. Went through the surgery, took about 45 minutes, and then I was in recovery. And in recovery, they went over the things I needed to do in the next 24 hours to take care of myself and gave me some pain medication. Now, I was really concerned about pain, because this was an unknown procedure to me and I didn't know what to expect. And I will tell you that after I came out of surgery, the pain wasn't that bad. In fact, the most discomforting thing as far as pain was concerned was the catheter. And so for the first 24 hours that the catheter was in, I experienced a lot of discomfort because of it. And after 24 hours, they removed the catheter and the pain subsided because the incision for the implant is only about that big. I took myself off of pain medication probably the 2nd or 3rd day because I felt comfortable. The other things that I had to do was no heavy lifting for about 6 weeks because I did have a small incision in my abdomen. And the other thing that I found helpful, especially during the first week or 2, is to wear loose-fitting clothing. And that's because for the first week I had half an erection. And what I found is if I wore tight clothing and a pair of jeans, the tissue would rub up against the fabric and would become irritated. So for the first week, week and a half, I wore a very loose pair of gym shorts. And that was a lot more comfortable than wearing a pair of jeans and underwear. After about 6 or 8 weeks, I went in for training on how to use the pump. And it's a very straightforward, simple process, and I was able to master the process in about 2 15-minute visits. The first time, like any new skill, I had some difficulty, but Dr. Blick met with me about a week later, and we worked with the pump and learned the proper technique in inflating it. Now, my implant has 3 parts. There are different types of implants, and my implant has the cylinders, which are in the penis and cause the erection itself. There's a reservoir that stores the saline solution, and there's the mechanical pump itself, which is in my scrotum. Now, you're probably wondering how all this feels. Well, before surgery, my penis felt very soft and spongy. But after surgery, there was a little firmness to the penis, and that's because the cylinders are now implanted in the penis. During sex, there really is no difference in my feeling before the surgery and after the surgery. That means all the feelings that I would normally have in intimacy were exactly the same after the pump was implanted. And that was very comforting to me. So I could have what I would consider a normal sexual relationship with my wife, and there was no odd feeling to that. It performed as it was expected to perform. Now, there were some pros that we found with the pump and using it. One, we didn't have to take expensive pills. The other thing is it restored a sense of spontaneity to our relationship. Before, when I took pills or the injection or used the penile vacuum pump, we lost that sense of spontaneity because we had to wait for medication to take place and become effective, and after the medication became effective, it was only effective for a certain period of time. So we lost all this spontaneity in our relationship. With the pump, the penile implant pump, we now have spontaneity. So if we decide that we want intimate relationships today, we simply inflate the pump, have intimacy, and then when we're done, deflate the pump. And the other thing that I noticed was when I was on the medication, I would climax and the erection would disappear when on the medications, the pills. With the pump, I can have a climax, but the erection still remains in place, so we can continue our intimacy for some period after that, and everyone feels much more satisfied with the evening. So I hope this gives you some good ideas and some ideas of questions you may want to ask your physician as you travel this journey. I found things to work very well for me with the penile implant, and that may be an option for you, but you need to talk to your doctor and get all of the information that you can. So hopefully you found this helpful. Thank you.